Welcome to today's lecture on the fascinating topic of cutaneous fungal infections and their intricate immune response mechanisms. In this comprehensive session, we will delve into various aspects of superficial and cutaneous fungal infections, ranging from immune responses to diagnostic challenges and treatment strategies. By the end of this lecture, you will have a detailed understanding of the complexities surrounding these infections and the therapeutic interventions available. So, let's begin our exploration into the world of cutaneous fungal infections. The immune response to superficial and cutaneous fungal infections involves both innate and adaptive immunity. Innate immunity detects and destroys fungal pathogens through phagocytic cells. Adaptive immunity, involving T and B lymphocytes, produces specific immune responses to control the infection. Cytokines, such as TNF-alpha and interleukins, play important roles in the immune response, and immunomodulatory therapies targeting these cytokines can be effective in treating severe fungal infections. In dermatophytic folliculitis, various clinical presentations exist, making diagnosis challenging. Treatment options range from topical antifungals for localized cases to systemic therapy for extensive or recurrent infections. Hygiene education and lifestyle modifications are important preventive measures. In summary, diagnosing cutaneous fungal infections in neonates is challenging due to limitations of traditional diagnostic methods and the complexity of this population. Early detection and prompt management are crucial in improving patient outcomes. A multidisciplinary approach and the use of molecular methods can aid in accurate diagnosis and timely treatment. In summary, preventing recurrent cutaneous fungal infections involves a multifaceted approach that considers individual risk factors, utilizes antifungal prophylaxis judiciously, promotes lifestyle modifications, and tailors interventions based on patient characteristics. In summary, it is important for healthcare professionals to be aware of the possibility of deep fungal infections presenting with superficial clinical manifestations. Appropriate diagnostic approaches and collaboration among specialists are essential for timely and effective management of these infections. In summary, the epidemiology of atypical cutaneous fungal pathogens involves exploring their distribution, prevalence, and clinical significance. This includes understanding their prevalence in specific populations and geographical regions, as well as their potential to cause significant morbidity. Superficial and cutaneous fungal infections caused by trichosporin SPP primarily affect immunocompromised individuals. Prompt initiation of combination antifungal therapy, such as amphotericin B and echinocandins, is crucial for successful management. Close monitoring and minimizing resistance are important as well. Fungal biofilms represent an important factor in the development of recurrent superficial infections. Biofilms are complex, multicellular structures formed by fungal pathogens on various surfaces, including the skin. These biofilms provide protection against host immune responses and commonly contribute to treatment resistance and recurrence. Understanding the formation and impact of fungal biofilms is crucial to devise strategies for their disruption or prevention. Various approaches, including physical disruption, antifungal combination therapies, and the development of novel anti-biofilm agents, are being explored. Breaking down the biofilm matrix and enhancing the penetration of antifungal agents remain key objectives. Moreover, understanding the factors determining biofilm formation and their interaction with host immunity can aid in the development of targeted interventions. In summary, molecular methods such as PCR and DNA sequencing show promise in improving the diagnostic accuracy of superficial fungal infections compared to conventional methods. However, further research and standardization are necessary to fully utilize these techniques in clinical practice. Antifungal resistance in dermatophytes is a growing concern for the treatment of skin fungal infections. Understanding resistance mechanisms can guide treatment options. Combination therapy and alternative agents are being explored as potential solutions. Collaboration among specialists is crucial in monitoring and managing resistance. Different species of cutaneous Candida can exhibit significant genotypic variations and possess various virulence factors, impacting disease severity, manifestation, and treatment outcomes. Candida species, including C. albicans, C. parapsilosis, C. tropicalis, and C. glabrata, are commonly encountered in cutaneous fungal infections. Understanding the genetic diversity and virulence factors of each Candida species can aid in predicting disease outcomes and guiding appropriate treatment approaches. Factors such as adhesion proteins, secreted hydrolytic enzymes, phenotypic switching, and antifungal resistance mechanisms are among the key determinants of Candida pathogenicity. Identifying such virulence factors enables the development of targeted therapeutics and personalized treatment strategies for optimal patient care. The management of onychomycosis, a common nail fungal infection, often presents challenges. Itraconazole pulse therapy, where a fixed dose of itraconazole is administered intermittently, has emerged as a treatment option with proven efficacy. However, concerns exist regarding its safety profile, potential drug interactions, and patient selection criteria. Evaluating the efficacy of itraconazole pulse therapy requires a comprehensive understanding of the treatment regimens, duration, and patient factors influencing response. Drug interactions, particularly with cytochrome P450 enzyme inhibitors or inducers, necessitate careful consideration to minimize adverse effects and optimize treatment outcomes. Additionally, patient selection criteria, such as liver function tests and the absence of contraindications, ensure the safety and efficacy of itraconazole pulse therapy in onychomycosis management. In summary, cutaneous fungal infections can be effectively diagnosed, treated, and prevented by understanding the immune response mechanisms. Keeping up with research and advancements is key to improve patient outcomes in clinical practice.